Video lecture chapter 21, Bite Wing Technique, Dental Radiography, Principles and Techniques. Basic concepts, terminology, principles of bite wing technique, beam alignment device and bite wing tab, bite wing receptors, position indicating device angulation, rules of bite wing technique. Bite wing technique, a method used to examine the interproximal surfaces of teeth. Useful to monitor the progression of dental caries, assess existing restorations, and examine the crestal bone levels between teeth. Terminology includes interproximal examination, bite wing receptor, alveolar bone, crestal bone, contact areas, horizontal bite wing, opened contacts, overlapping contacts, and vertical bite wing. Principles of bite wing technique. The receptor is placed in the mouth parallel to the crowns of both the upper and lower teeth. The receptor is stabilized when the patient bites on the bite wing tab or beam alignment device. The central ray is then directed through the contacts of the teeth using vertical angulation of plus 10 degrees. Bite wing beam alignment device is a device used to position an intraoral receptor in the mouth and maintain the receptor in position during the imaging procedure. A bite wing tab is an alternative to the beam alignment device. It's a heavy paperboard tab or loop fitted around a periapical receptor and used to stabilize the receptor during the exposure. Bite wing receptors come in size 0 for posterior teeth of children with primary dentitions, size 2 for posterior teeth of older children and adults, placed horizontally or vertically, and 3 for bite wings but not recommended for adult patients. Position indicating device angulation. Angulation is the alignment of the central ray of the X-ray beam in horizontal and vertical planes. It can be varied by moving the PID in a horizontal or vertical direction. Horizontal angulation, correct horizontal angulation. The central ray is directed perpendicular to the curvature of the arch and through the contact areas of the teeth. Incorrect horizontal angulation results in overlapped contact areas. Vertical angulation is the positioning of the PID in a vertical or up and down plane. Positive, the PID is positioned above the occlusal plane and the central ray is directed downward. Negative, the PID is positioned below the occlusal plane and the central ray is directed upward. Vertical angulation, correct vertical angulation includes positive 10 degree. Incorrect vertical angulation would result in a distorted image. Rules of bite wing technique include receptor placement, position, angulation of vertical and horizontal, and receptor exposure. Step-by-step procedures, patient preparation, equipment preparation, exposure sequence for receptor placements, and receptor placement. In patient preparation, we will explain the imaging procedure to the patient, position the patient upright in the chair, adjust the headrest, place and secure the lead apron with thyroid collar, request that the patient remove eyeglasses and all objects from the mouth. In equipment preparation, set the exposure factors. If a beam alignment device is used, open the sterilized receptor package containing the beam alignment device and assemble the device on a covered work area. If a bite wing tab is used, attach the tab to the white side of the film on the correct side of the receptor. Exposure sequence for receptor placements. 2 bite wing receptors are typically exposed on each side of the arch. 1 bite wing receptor may be sufficient when posterior teeth are missing. For bite wing and periapicals, expose all anterior periapical receptors first, follow with posterior periapical receptors, Finish with bite wing exposures. For bite wing only, expose the premolar bite wing receptor first, expose the molar bite wing receptor next, and repeat on the opposite side. Receptor placement, the specific area where the receptor must be positioned before exposure, and this is dictated by the teeth and surrounding structures. If using film, the white side of the receptor faces the teeth. If using film, the identification dot has no significance in bite wing receptor placement. In the posterior bite wing series, the receptors are placed horizontally. Center the receptor over the area to be examined and ask the patient to slowly bite on the bite wing tab or bite block of the beam alignment device. Placement for a 4-receptor posterior bite wing series includes right and left premolar, right and left molar. Vertical bite wings are used to examine the level of alveolar bone, placed with the long portion of the receptor in a vertical direction, often used as post-treatment or follow-up films for patient with bone loss due to periodontal disease. Modified CMS may be prescribed using vertical bite wing images. Modifications in bite wing technique. Periodontulus spaces, cotton rolls, must be placed in the area of the missing tooth to support the bite wing tab or beam alignment device. With bony growths, a receptor must be placed between the tori and the tongue. This concludes our video lecture.